Hello everyone, my name's Neil Hopper and thanks for asking me to talk in this resilience session. I'll preface this by admitting that I don't think I'm particularly resilient. I just managed to get through last year without dying or going mad. But I'll tell you a bit about my story and a few things I learned along the way. So I have no real conflicts of interest other than the fact I'm a current patient of the Thornbury Centre in Plymouth and Dorset Orthopaedics in Ringwood. I have no financial or other relationship with these other than the fact that I'm their patient. So a little bit about me. I'm pretty unremarkable, pretty standard person really. I'm 44 years old, and although I'd say I was fit and well, fit would be in inverted commas. I'm completely gymophobic, and apart from suffering from no major medical illnesses, yeah, that was me. I also wouldn't have categorised myself as particularly resilient, other than the fact that I survived higher surgical training in Wales with some rather difficult bosses along the way. Last year I was camping with my son and daughter, and I became unwell. Both myself and my daughter became unwell with diarrhea and flu-like symptoms. We abandoned the camping trip and went home, and over the course of the next couple of days my daughter got better. I didn't really, it just sort of hung around. I felt generally flu-y, achy joints. So one evening I went to bed a bit early with some painkillers and a glass of whiskey, and the next thing I really remember is waking up in recess in the Royal Cornwall Hospital, unwell, low blood pressure, feeling pretty rotten. I was transferred up to ITU and given fluids and antibiotics, and my general condition improved relatively quickly, but my feet that were blue on admission continued to get worse and eventually started looking like this. This picture's been pixelated because it's not a particularly nice thing to look at. My left foot was very similar. So I was transferred to the DDRC in Plymouth for some hyperbaric oxygen therapy. I found this pretty tough. 4 hours of being stuck in a tube, unable to read or read a book or watch telly or anything like that. It was pretty boring. And I was set for 40 of these sessions, but after about 15 or 16, I became septic again and ended up having bilateral forefoot amputations. These were done in Derriford, and I was under the care of Commander Chris Parry and Mr. Frank Dix, two surgeons who were amazing. I owe them everything. I couldn't ask for two nicer, more caring and competent people to be looking after me. So anyway, I found having forefoot amputations very challenging. I'd lost a lot of the plantar skin on my feet as well, so I couldn't walk. And I don't particularly like forefoot amputations. I don't do a lot of them in my practice. So looking down and seeing them at the end of my feet was pretty hard to deal with. So I had a week of various plastic surgical opinions, and it was decided that probably for function-wise the best thing I could do was have bilateral below-knee amputations, and I just wanted to get it sorted and fixed. But signing the consent form on the Thursday evening prior to the operation was pretty tough, and it's fair to say I had quite a significant panic attack that evening, required a lot of diazepam, and the feeling of being out of control and things overtaking me was horrendous. But eventually managed to get to sleep, and the next day I had my surgery. And actually, despite seeing this, I felt a lot better, a lot more positive, and at least the thought of going home was in sight. And at this point, things were pretty good. I had lots of people fussing around me. I was the centre of attention. I had lots of physios, cards, gifts, countless bottles of gin given to me. So yeah, I started feeling a bit better, and then I got discharged, and it's fair to say the wheels came completely off the car. I felt immobile, stranded. I was really bored, and just had this persistent thought in my head that I would never work again and be pretty useless as an individual. So I had a much needed kick up the arse from my wife. Set myself some goals just to see if I could get myself out of this rut. I tried to see if I could walk as soon as I could, to return back to work, to get off the pre-gabbling that was completely freezing my brain. It was like thinking through fog. And also I wanted to work on just trying to get used to my new situation. So I used some Jedi mind tricks. I tried to visualize positive goals, like playing football with my son or walking the dog on the beach. And for those of you who don't know, walking as a double amputee on sand is ninja level mobility. So set that as a goal. I go swimming with my daughter, but also try to visualize sitting in the coffee room between cases with my colleagues, the banter and the surgical mess, stuff I really missed, contact with human beings other than my family. Not to say there's nothing wrong with my family, but and also I just wanted to be the person who hardly ever used their wheelchair and got around on prosthetics. So I also tried to make sure I celebrated the good and didn't really dwell on the bad stuff. So the picture on the left is the day I got my new legs and got up and walked. And after being sat down for 3 or 4 months, that was absolutely amazing feeling. The picture on the right is a little bit of a setback. Ended up doing an aortic EVAR revision open and got a fresh sore on the end of my stump, and that took a good few weeks to heal. So I'm learning. So the other thing that I tried to do, and this was probably key for me, is managing my sort of grief. I always imagined it as a great big ball of fire, like a sun, and if I didn't look at this ball of fire, it would get bigger and brighter, but it hurt to look at it. So I would just try and metaphorically glance at it every now and again just to keep it under control, and then imagining my friends and family like a pair of sunglasses, and they sort of help me look at this ball of horribleness a little bit longer, and eventually this sun begins to dim and get smaller. I'm not sure if it'll ever go away completely, if there'll ever be a sunset, but certainly it's getting easier to deal with. So how did I do? Well, in the most part, I achieved my goals and in many cases surpassed them. I went down the gym, which people who know me think is hilarious. It took me losing my legs to become a gym bunny. I did some paddle boarding, which I really enjoyed. Got myself a trike. Unfortunately, I tried riding a bike and that's impossible. And I got back to work and got back to theatre, and occasionally had to tape theatre shoes on when I haven't got my own. So, but I'm still up and down. I have the advantage or disadvantage of feeling like my feet are there all the time. So every morning I wake up and think it's all a bad dream, then pull back the bedclothes and sort of realise it's not. So I get this little cycle of grief every day, just about. I have had some physical setbacks and blisters that have sort of knocked my confidence a little bit, but generally not too bad. But I do get these strange sort of demons in the night. I get these thoughts. One of the recurring thoughts I get is, and it's very strange, is I have no toes, I have no ankles, I have no heels, which gets stuck in my head sometimes, and it's a little bit strange. So I don't have all the answers. I'm certainly a work in progress, but I think I'm getting there. And my sort of most positive thing really is I'm really grateful to my friends and family. And I got back to work. I did it. I'm doing full-time on calls, so I've achieved it. So that's now allowing me to contemplate the next step, which may be to cut back a little bit because it is physically demanding, but I've got nothing to prove now. So yes, I am definitely now on plan B. Plan A is shot out the window and is gone. But the benefit of plan B is I now get to write it, and who's to say that plan B should be any worse than plan A, other than different? Many thanks.